Let me ask you something. Right now, as you're watching this, your kidneys are filtering your entire blood supply. They've done it every single minute of every single day of your life. They remove waste, they balance your fluids, they regulate your blood pressure, they even tell your bones how many red blood cells to make. Your kidneys are working relentlessly, and in return they ask for almost nothing. But here's what I've learned after more than 30 years of practicing medicine, including years spent working in internal medicine and caring for older patients. The kidneys are the most quietly ignored organs in the human body. Most people never give them a second thought until the damage is already done. And by then the options narrow dramatically. I've sat with patients in my office who were facing dialysis, who were on transplant waiting lists. And when we went back through their history together, the warning signs were always there. The foamy urine they noticed 2 years earlier, the ankles that kept swelling, the exhaustion that no amount of sleep could touch. The clues were present for months, sometimes years, but nobody connected the dots. Nobody recognized that these weren't just normal parts of getting older. They were distress signals from kidneys that were quietly failing. What if those same signals are present in your life right now, and you're explaining them away as something else entirely? Fatigue you blamed on poor sleep, swollen ankles you wrote off as a long day on your feet, itchy skin you thought was just dry winter air. Those are not random inconveniences. Those are your kidneys asking you to pay attention. I'm Dr. Grace Watson. I've spent decades working with older adults, and kidney disease is one of the conditions I care most deeply about, precisely because it is so preventable when caught at the right time. And yet most people arrive at serious kidney disease without ever having received a clear, honest explanation of what to look for. Today, that changes for you. We are going to walk through 7 early warning signs that your kidneys are struggling. Not in vague terms, not in medical jargon you'd need a textbook to understand, but precisely clearly with an explanation of what is actually happening inside your body when each of these signs appears. Because understanding what's happening at a physiological level is what separates people who act early from people who act too late. Stay with me through all 7. The last 2 surprise almost everyone. Before we get to the warning signs, let me give you a quick picture of what your kidneys actually do. Because without that foundation, the warning signs don't carry the weight they deserve. You have 2 kidneys, one on each side of your spine, roughly at the level of your lower back. Each one is about the size of your fist, and together, these 2 fist-sized organs filter approximately 200 L of blood every single day. That number is almost hard to believe, 200 L every day without pause. Inside each kidney are roughly 1 million tiny filtering units called nephrons. Think of each nephron as an incredibly precise sieve, one that lets waste products and excess fluid pass through into your urine while keeping proteins, red blood cells, and other essential components exactly where they belong in your bloodstream. On top of filtering, your kidneys regulate your blood pressure. They manage your electrolyte levels, sodium, potassium, calcium, the minerals that allow your heart to beat and your muscles to contract. They produce a hormone called erythropoietin that signals your bone marrow to create red blood cells. They activate vitamin D so your bones can absorb calcium properly. When your kidneys begin to fail, none of that happens correctly anymore. And your entire body, your heart, your brain, your muscles, your bones, begins to feel the consequences. The tragedy, and I use that word deliberately, is that in the early stages of kidney disease, you might not feel dramatically ill at all. The warning signs are real, but they're easy to explain away. Which is exactly why I want you to know them with precision, because the earlier this is caught, the more of your kidney function can be saved. And that difference between early and late can be measured in decades of quality life. I want you to think about the last time you used the bathroom. Not something most people pay attention to, I know. But I need you to start some foam when you urinate, especially if you haven't had much water and you're urinating with some force. That's completely normal. It comes and goes quickly. A few bubbles, nothing unusual. But if you're seeing foam that looks thick, foam that persists, foam that reminds you of what happens when you add dish soap to water, that is not normal. And it is one of the most direct visible signals your kidneys can send you. Here's what's happening. Inside those million nephrons we talked about, there's a filtering membrane that acts as a highly selective barrier. It's designed to keep large, valuable molecules, specifically proteins, inside your bloodstream. When your kidneys are healthy, almost no protein escapes into your urine. But when those filtering membranes become damaged from high blood pressure grinding against them year after year, from elevated blood sugar and diabetes slowly destroying them from inflammation, they begin to leak. Protein, particularly a protein called albumin, starts escaping into your urine. And when protein is present in urine, it acts exactly like soap. When agitated, it foams. Now there's another layer here that matters. The protein leaking through your kidneys doesn't just reflect existing damage. It actively makes things worse. Protein in the kidney tubules triggers inflammation. That inflammation causes scarring. That scarring destroys more nephrons. It becomes a cycle that compounds itself quietly with no dramatic symptoms to alert you until the damage is significant enough that your options have already narrowed. This is why the timing of detection matters so much. People who catch this at the foamy urine stage still have intervention available to them. People who catch it years later when the scarring is extensive are managing a condition they could have slowed dramatically. If you are seeing persistent foam most times you urinate, not occasionally. I want you to make one phone call this week, not next month, this week. A simple urine test, what doctors call a dipstick test, can detect the presence of protein within minutes. If protein is present, a 24-hour urine collection can tell us exactly how much you're losing. Catching this early is genuinely life-changing. The same condition that is manageable at this stage can become irreversible if ignored. This one has probably happened to almost everyone watching this video at some point. You spend a long day on your feet. You take a long flight. You stand in the heat. Your ankles puff up a little. You elevate your legs overnight, and by morning it's gone. That is normal. That is not what I'm describing. What I want you to watch for is swelling that returns persistently. Swelling that doesn't fully resolve with rest. Swelling that pits, meaning if you press your thumb against your ankle for a few seconds and release it, you can see an indentation that stays there. That kind of swelling tells a very different story. Remember the protein we talked about, the albumin leaking out through damaged kidney filters. Here's where that protein loss creates a second problem, one you can see with your own eyes. Albumin in your bloodstream creates something called oncotic pressure. Think of it as the force that keeps fluid inside your blood vessels, like a sponge that holds water. When your albumin level drops because it's being lost through your urine, that holding force decreases. Fluid escapes from your blood vessels and seeps into the surrounding tissue. Gravity does the rest. That fluid pools in the lowest point of your body, your ankles, your feet, eventually your lower legs. As kidney function worsens, it can climb to the knees, the thighs, and in advanced cases the hands, and even the face. There's a second mechanism working alongside this one. Damaged kidneys struggle to excrete sodium efficiently, and wherever sodium goes, water follows. So you're retaining fluid on two fronts simultaneously. Less protein holding it inside your vessels, and more sodium pulling it in from outside. Most people who have this swelling assume it's just age, just circulation, just something they have to live with. And while they're living with it, the underlying kidney damage continues accumulating. Months pass, sometimes years. By the time the swelling is severe enough to prompt a doctor's visit, significant function may already be lost. A blood test for albumin and a basic kidney function panel can start to clarify within a single visit whether your kidneys are contributing to the swelling you've been noticing. One visit, one conversation. That's all it takes to start getting answers. I want to be careful with this one because fatigue is one of the most common complaints I hear from patients of any age, and the causes are many. Poor sleep, stress, thyroid issues, low iron. All of these can cause fatigue. So I'm not asking you to become alarmed every time you feel tired, but there is a specific quality of fatigue that kidney disease produces. And once you understand the mechanism behind it, you'll be able to recognize the difference. Your kidneys produce a hormone called erythropoietin. Doctors often call it EPO, and it plays one essential role. It tells your bone marrow to manufacture red blood cells. When your kidneys are damaged, EPO production falls. When EPO falls, your bone marrow slows its production of red blood cells. When you have fewer red blood cells, you have less capacity to carry oxygen through your body. The result is anemia, but it's not the kind of anemia that comes from not eating enough iron-rich foods. This is anemia driven by a fundamental hormonal failure, and the fatigue that comes with it is different from ordinary tiredness. This fatigue is heavy. It sits in your bones. It makes you need to rest after activities that used to require no effort at all. Walking up a flight of stairs, carrying groceries, having a conversation, your brain feels foggy because it isn't getting the oxygen it needs. You find yourself short of breath with minimal exertion, and no amount of sleep seems to touch it. Because it develops gradually, people almost always adapt to it. They tell themselves they're just getting older. They drink more coffee. They cut back on activities. They stop doing things they used to love and quietly accept that this is simply who they are now. What they don't realize is that their body has been sending them a signal the entire time, and that the window to act on that signal is getting smaller with every month that passes. By the time the anemia is severe enough to prompt testing, significant kidney damage has often already occurred. That is the pattern I have watched repeat itself more times than I care to count. A complete blood count, one of the most basic, inexpensive blood tests available, will show this anemia immediately. If anemia is present and there's no obvious cause, your doctor should be checking your kidneys. That is not an overreaction. That is the correct medical response. I want you to think back over the past few months. How many times are you typically waking up to use the bathroom each night? If the answer is once and you're over 50, that's relatively common. The bladder changes with age. That alone isn't particularly concerning. But if you're getting up 2, 3, 4 times a night, if this pattern has developed or worsened over recent months, if the volume you're producing at night feels significant, I want you to consider whether your kidneys are losing an ability most people have never even heard of, the ability to concentrate urine at night. When you're healthy, your body produces a hormone called antidiuretic hormone, ADH, as you sleep. This hormone travels to your kidneys and instructs them to conserve water, producing small amounts of highly concentrated urine so that your bladder fills slowly and you can sleep through the night. It's why your first morning urine is typically dark. Your kidneys did their job overnight. When kidney function declines, the tubules inside your nephrons lose their ability to respond to ADH properly. They can't concentrate urine anymore. Your kidneys keep producing dilute urine throughout the night as if they've lost their awareness of your body's sleep cycle. Your bladder fills repeatedly. You wake up repeatedly. And here is what makes this particularly insidious. Poor sleep from repeated nighttime waking accelerates nearly every health problem an older adult faces. Cardiovascular disease, cognitive decline, immune function, blood sugar regulation. So you have kidney disease disrupting your sleep, and that disrupted sleep then accelerating the very conditions, diabetes, hypertension, that damage your kidneys further. It compounds itself in a loop that most people never identify because they never knew this symptom was a kidney sign in the first place. The pattern to watch for is progressive worsening. Nocturia that's clearly gotten worse over months, particularly if it's accompanied by any of the other signs we're discussing today. Don't accept it as inevitable. Get it investigated. A urine concentration test alongside a basic kidney function panel can tell your doctor a great deal about what's happening. Everyone has woken up with puffy eyes at some point, after crying, after too little sleep, during allergy season. That's normal, and it fades within an hour or two. The kidney-related version is different. It's bilateral, both eyes roughly equally. It tends to be worse in the morning and improves as you move through your day, and it keeps coming back day after day. Here's why morning makes it worse. When you sleep horizontally, the fluid that normally pools in your lower legs and ankles, the fluid that's escaping your bloodstream because your albumin levels are too low, redistributes. It spreads through your body more evenly, and the tissue around your eyes, which is among the thinnest and most elastic skin on your body, accumulates that fluid very visibly. You wake up and it's immediately apparent. As you get up and start moving, gravity takes over again. The fluid moves downward. The puffiness softens though as kidney disease progresses. It may not fully disappear, even by midday. Now I want to be fair here. There are many reasons for puffy eyes, and most of them have nothing to do with your kidneys. What I'm asking you to do is connect the dots. If you're waking up with puffy eyes, and you also have any foam in your urine, or swelling in your ankles, or unusual fatigue, those signs together should prompt a conversation with your doctor, particularly if you have diabetes, high blood pressure, or a family history of kidney disease. I've had patients tell me they noticed the morning puffiness for over a year before they mentioned it to anyone. They assumed it was cosmetic. They assumed it was sleep. They didn't know it was their kidneys speaking to them. And that year of delay represented kidney function that could not be recovered. Any of those risk factors combined with more than one of these signs is a reason to get a blood test and urine test. Not next month, this week. Most of us have experienced a leg cramp at some point. That sudden sharp contraction that wakes you at 3 in the morning. Usually it's dehydration or mineral imbalance after exercise, or simply the position you were sleeping in. It resolves quickly and doesn't return. But here's the question I want you to ask yourself. Are these cramps becoming more frequent? Are they occurring at rest, not just after activity? Are they severe enough to interfere with sleep, night after night? Your kidneys regulate the precise balance of electrolytes in your blood. Sodium, potassium, calcium, magnesium, phosphate. These are not just minerals. They are the electrical signals that allow every muscle in your body, including your heart, to contract and relax on command. When they are in balance, your muscles work smoothly and silently. When they're out of balance, your muscles fire in ways they shouldn't. As kidney function declines, this electrolyte regulation becomes impaired. Calcium levels that fall too low make muscles hyperexcitable. They're primed to fire. Magnesium deficiency impairs the ability of muscles to relax after contracting. Potassium that swings too high or too low disrupts the entire electrical system of your nerves and muscles. The combination is exactly the right environment for severe repeated cramping. Kidney-related muscle cramps tend to be more intense than ordinary cramps. They occur more often at rest. They may come alongside other symptoms: weakness in the legs, numbness or tingling in the fingers, or what some patients describe as a fluttering or irregular sensation in the chest. People endure this for months. They buy magnesium supplements at the pharmacy. They stretch before bed. They change their sleeping position. Sometimes those things help briefly, but if the underlying cause is kidney dysfunction, The electrolyte imbalance keeps returning because the organ responsible for maintaining that balance keeps failing to do so. And while they're managing the symptom, the disease continues to progress. Don't manage this symptom without first knowing its cause. A comprehensive metabolic panel measures your electrolytes alongside kidney function markers. It can reveal this problem in a single blood draw. That is how simple the first step is. This is the one that surprises people most. Itchy skin. Not a rash, not a bite, not a patch of eczema, just a deep, widespread itch, especially at night, that doesn't respond to moisturizers or antihistamines. An itch that seems to come from inside. This has a medical name, uremic pruritus, and it is one of the most debilitating symptoms of kidney disease that doesn't get nearly enough attention. When your kidneys are functioning properly, waste products are filtered out of your blood continuously. When kidney function falls far enough, those waste products begin to accumulate. Some of them are deposited in the skin where they trigger inflammatory responses. The immune cells in your skin react to these accumulated compounds as though they're a foreign substance, and itching is the result. There are other mechanisms compounding this. In kidney disease, parathyroid hormone levels rise. The kidneys fail to properly regulate calcium and phosphate, and the parathyroid gland compensates by producing more hormone. Elevated parathyroid hormone is independently associated with itching. Additionally, the nerve fibers in the skin become sensitized by the metabolic disturbances of kidney disease, causing what we call neurogenic itch, a sensation of itching with no visible skin change at all. What makes this particularly distressing is that ordinary treatments don't reach it. You can apply every lotion available, you can take antihistamines. The itch does not respond because the source is internal, not on the surface. I have had patients tell me this itch kept them awake every single night for months, that it affected their mood, their relationships, their ability to function, and the entire time they were treating the surface of their skin when the problem was inside their kidneys. If you have unexplained itching that's widespread, that's worse at night, that has persisted for weeks, and particularly if you have any risk factors for kidney disease, this symptom needs to be investigated, not dismissed, not managed with creams. Investigated. Let me bring these 7 signs together, because when you see them as a whole, the picture becomes clear. Foamy urine tells you your filtration barriers are leaking. Swollen ankles and puffy eyes tell you your kidneys have lost control of fluid regulation. The profound fatigue tells you that your body isn't producing enough red blood cells because your kidneys aren't producing the signal to make them. Waking repeatedly at night tells you your kidneys have lost their ability to concentrate urine according to your sleep cycle. The muscle cramps tell you your electrolyte balance, the electrical system of your muscles is being disrupted, and that persistent, untreatable itch is your body's response to waste products accumulating in places they should never be. None of these signs in isolation guarantees kidney disease. I want to be clear about that. You might have puffy eyes in the morning, and it's allergies. You might have occasional leg cramps, and it's dehydration. Having one of these signs does not mean you should be alarmed. But if you have 2 or more of these signs, especially if you have risk factors like diabetes, high blood pressure, a family history of kidney disease, or if you're over 65, the combination matters. The pattern matters, and it warrants a simple, inexpensive blood test and urine test that your doctor can order in any routine visit. Here's what those tests look like. A blood test for creatinine and a calculation called GFR, glomerular filtration rate, tells your doctor how efficiently your kidneys are filtering. A urine test for protein tells your doctor whether your filtration barriers are intact. These 2 tests together paint a remarkably clear picture. What they don't require is an emergency. They don't require symptoms that are already severe. They can be done at your next checkup if you bring this conversation to your doctor. The barrier to early detection is not medical, it is awareness. And you now have it. I've seen patients discover kidney disease after years of unnoticed symptoms. What I feel in those moments isn't frustration, it's grief, knowing how much could have been preserved with earlier intervention. Early kidney disease isn't a death sentence. With the right diet, blood pressure, and blood sugar control, and monitoring, progression can often be slowed, sometimes for decades. The window to act is subtle and short, but now you know what to look for, and the difference early detection can make. It might be as simple as a phone call, a blood test, or a conversation with your doctor. Your kidneys can't speak, but they communicate through your body. The only question is whether you'll listen. If this message resonates, share it with someone who could benefit. For questions or deeper guidance on signs, testing, diet, and kidney protective lifestyle, comment or subscribe. I'm Dr. Grace Watson. Take care of yourselves and your kidneys.